Welcome to our panel. I want you to visualize us sitting in my living room with the fireplace on. This is really just a chat. We don't want it to, it's not scripted, it's not rehearsed. I do have some questions that I'm going to put out there. They're very open-ended. And this is an opportunity for us to get to know the people that we work with and that we depend on every day. These are other agencies. I say the other because I'm from Head Start, but and so all of us here in this room really depend upon each other, and we need each other. And this is a time for us to develop an appreciation and an understanding of what other people do and why they do it and why it's important. Because I think oftentimes, especially when regulation is involved, it's like, oh, that's so annoying. Why do we have to do that? Well, there is a why, and that's what we're going to take a little time to just explore. The why and the who and what happens if regulation isn't there, and why it's so important to us. So we're going to start, and I'm going to ask each one of our panelists, we can start at that end, that would be fine, and just tell us a little bit about who you are, the mission of your project, and some of the outcomes that you expect as a result of your work.
My name is Sue Porting. I don't know if this is on. Can you guys hear?
There we go.
My name is Sue Porting. I'm with the Section for Child Care Regulation. And I think Kathy Quick covered a lot of what I had on my notes in terms of our mission. The section's mission is to assure the health, safety, growth, and development of Missouri's children through a regulatory process to prevent injury, risk, or harm to dependent children in out-of-home care, child care settings. Expected outcomes, obviously, for the section for child care regulation are healthy and safe child care environments for children.
Why is this work so important to you? It's obviously important. You come to it every day. Why is it so important?
Well, obviously, children are a very vulnerable population, and prevention, licensing is all about prevention. And so if we can prevent injury or risk of harm to a child, that's very rewarding, rather than being on the backside and reacting to something that has happened.
That's a really good point. How many times do you hear like Brian's Law or Megan's Law or somebody's law, and that law, that name is a person, a child often that something terrible happened to, and so now we finally got around to doing something about that problem in their name. Good point. Okay, tell us a little bit about who you are and what you do.
My name is Ron Thompson. I'm the Deputy Chief of Inspection Unit for the Division of Fire Safety at the state. We're the guys that come out and tell you all about the fire safety issues that you're either working through or you're not. And the mission that we have is to make sure that a fire-safe environment is being maintained in the facilities that we inspect. A fire-safe environment not only in the terms of fire itself, but we have the issues of carbon monoxide and smoke propagation from anything that might be smoldering, not to necessarily break out in an open flame. So we're looking for a lot of different things that some people maybe take for granted as being safe, but through history we find that safety is only relevant when people pay attention to what is safe. And so that's one of the things we try to do is raise the level of awareness.
What a good point. By the time we realize it's not safe, it's a little late to get started. Thank you. You're next, Craig.
My name's Craig Sullivan. I'm with the Bureau of Environmental Health Services with the Missouri Department of Health, and I cover actually northeast Missouri. I cover about 24 counties for sanitation in northeast Missouri. And I'll defer to Mike on some of the
Okay, Mike, you
my
want
boss.
to carry on?
My name is Mike Henderson. I'm the program manager for environmental child care program. There's 114 counties in Missouri, and we have participation agreements with most of those counties. So we train the local LPHAs to do child care inspections, and then we follow up to make sure those are being done correctly, hopefully. What we do, a lot of what we do in child care involves environmental factors that impact children much greater than they would adults, whether it's foodborne illness or some communicable disease. A lot of times the consequences are much greater for children than they are for adults. Even lead exposure, which would have little consequence with an adult, may cause brain damage or nerve system damage for a child. So that is our role in this, is to provide a safe environment for the child, and also to hopefully, with education and enforcement of regs, prevent disease outbreak.
Absolutely. Do you want to tell us about LPHA?
Those
I
are-
warn you, I'm looking for these acronyms that we not all
That's true,
be
that's
familiar
true.
with.
All counties, for the most part, have environmental public health specialists. They do food inspections. We have core public health functions in the state of Missouri, and we contract with those counties for those local health inspectors to do those inspections. There just aren't enough state employees to do all those. So the LPHAs are actually the local county inspectors that we hire and pay for their services, and we train. And that's usually what the child care facilities see in their facility.
Okay.
We will do the initial, but then they'll do the annuals and renewals.
Okay. Alicia.
Good afternoon. Can you hear me? I'm Alicia Jenkins. I'm with the Missouri Department of Social Services. I work in the Children's Division, and I work in the Early Childhood and Prevention Services section. Very pleased to be here today. We are responsible for administering the Child Care Assistance Program for the state. We're the lead agency for that. In regards to our mission, our goal is to work with strengthening families and moving them towards self-sufficiency. Most folks who engage with services with Department of Social Services may receive assistance through food stamps, medical services. We work with delinquency, prevention of child abuse and neglect, and of course with the Child Care Assistance Program. So we're very excited about being here today.
Thank you. Mary?
Good afternoon. My name is Mary Weathers, and I'm from the Office of Head Start in Kansas City. I'm just one of the one of the Head Start specialists in my office. But Head Start offers a systematic and integrated comprehensive approach to child development services and family engagement that leads to school readiness. Head Start views school readiness as children possessing the skills, knowledge, and attitudes necessary for success in school and for later learning in life. And the outcome is that children are ready for school, families are ready to support their children's learning, and schools are ready for children.
All right. So you kind of heard the nuts and bolts, but I want you all to think for a minute, because I'd like each of you to answer this question, or at least think about it, and that's, what would you like other people in this room to know about what you do? I think that often when we have an issue, it's because other people don't really understand. What is it that we are concerned about? They don't deeply understand. So think about that a minute, and share with us some aspects of your work that you would like everyone here for your colleagues to know and understand. Who'd like to start on that?
I'll take it.
All right.
I think one of the things that I like for folks to know is that we all have something in common in the sense that we're all concerned about safety and well-being for children. We are all invested in strengthening families. So we have a lot in common than we do different. In regards to the work that we do on a part of the Child Care Assistance Program is we partner heavily with Health and Senior Services section for child care regulation, even in the area of sanitation, training, professional development. We're also invested in working with the professional development registry that we have here in Missouri. We also partner with the Department of Elementary and Secondary Education as well, and all of these, and Head Start, Early Head Start. So we're working together as a team, regardless of whether you see it at the local level or not. There are a lot of things that are occurring at the statewide level that that are all focused on moving early childhood forward and making sure kids are ready to succeed in school.
All right. Who else would like to talk a little bit about, what do you want people to know about what you do?
Rhodanne, I'll go next.
Okay.
I think what I would like to highlight is the partnership that Early Head Start has had with the Missouri funding opportunity to, since about 1999, Missouri has put in lots of money to partner with Early Head Start and child care. And I think that's a great, that's one of the greatness that I see in this state of Missouri is the willingness to do that. Now, we know that there's been some funding cuts last year, and I think currently there's about 305 slots that are funded out of Missouri for those partnerships. But in saying that, I think that we need to pat ourselves on the back and say, you know, we're here as child care and Head Start, but we've been doing this for quite a few years, and we've learned a lot of lessons. And I think in regards to that, you know, we've learned things about the difference between child care licensing and Head Start ratios, and the difference between an early Head Start child an infant toddler can be served up to 3 and beyond for continuity of care, whereas we know that unless there's a waiver that, you know, child at 3 needs to exit. So there's some things that, you know, we've been working on, but I think in regards to how well the partnership has worked, when I go out to some of my programs in Missouri, I see and I hear a lot of great things, and I see family child care providers and partners who talk about the great training that's available and the partnerships within those entities.
That's a really good point, because once you have a vision, you want to be at the vision, and we forget that the vision was a long way away, and we've come this far toward it. We are making progress. Just being here is progress. Good point. You next, okay.
I guess one of the things that I'd like to relay to the people that are the recipients of our services, that being you all, whether it be the SCCR folks or the providers of the child care itself. The Division of Fire Safety's inspection unit doesn't do just inspections for SCCR folks. We work with with 7 different sets of state promulgated rules with a multitude of different agencies. Some of them with DHSS, some of them with the Department of Public Safety and others. And one of the things I guess I ask is understanding and grace from the providers. We make mistakes occasionally, and if you have questions about something that an inspector has said, we encourage you to ask them to talk to their supervisor. Especially in cases where you kind of get that deer in the headlight look and you say, that really doesn't make sense, because he may be trying to apply a rule from a different application, or he may be mistaken. You have several different options, and I'm not sure whether the handout made it here today or not, but we have a decision-making flow chart that we like to keep decisions at the lowest level, and that be between the provider and the inspector. But if that can't be achieved, then the provider has the opportunity to ask the inspector to speak to his supervisor. The supervisor then has the opportunity to address that at the lowest level between himself and the provider. If that doesn't work, then we go on up the chain somewhere in that. I'll get involved, and it could go as high as Kathy in the SCCR, or my boss, which is the assistant fire marshal. So we have different ways of dealing with things, and if you don't get an answer that makes sense to you, then just keep asking to speak to somebody a little higher in the chain. Don't take no for an answer from our people. Understanding everybody has a bad day, but my people are not to tell you no, all right? So I guess the 2 things that I'm asking is understanding, grace, and if you've got a question about something that you've been told, then ask to speak to somebody higher in the chain before you spend thousands of dollars doing something just because the inspector said so. Because there may be a different way of working around it, or it may be that he was mistaken in what he was trying to apply. we do have a lot of different rules that we're trying to work with, and I just ask you to take that into consideration for us, okay?
So it sounds like one of the things you really value is feedback, honest and thoughtful feedback, not just wild and crazy feedback, although maybe sometimes that too.
We get them both.
Craig, share with us a little bit. When we were sitting there at the table together having lunch, I learned something new about that I didn't know that you talked about, and that was this idea that local regulations can be different, and that you follow some of those local ones from if a county is different. Talk a little more to us about what would be helpful for us to understand. That was something that's helpful for me to understand. What else?
Well, some of the main things that we do, we train all the local health inspectors. So the inspectors that you guys see, us at the state level, what we do, we'll do all your initial inspections. So when you're new or up getting ready to start, the state inspector will come in and do your sanitation inspection. And then, like Mike was saying, and then we are contracted with the local health departments in the county for them to come in and do your inspection, but they are required to be trained by us with the state inspectors. So sometimes, we want the inspections to be, across the board. We want everybody to have the same compliance and be able to inspect the same from the same, rule book. But like Ron said, sometimes you have bad days, and
Welcome to the human race.
that's right.
Sue, tell us a little bit about what would you like your colleagues to understand and know about the work that you do?
I think piggybacking on some of what has already been said and some of what Kathy shared. Kathy shared during her comments that it's not the section for child care regulations goal or desire to be adversarial or to terminate licenses, close facilities. Our goal is for facilities to be in compliance, to be successful, and for children to be in safe childcare settings. So our staff do a lot of consultation and technical assistance and hopefully training on the licensing rules, because if people understand why the rule is there, the rationale behind the rule, people are more likely to follow it. And let's face it, we're in facilities on an average of 2 times per year. And the goal is for children to be in safe, quality childcare 365 days out of the year. So I would just like people to know about the technical assistance and consultation and training that our staff can provide.
Wow, that's a really good point. I wonder, I don't know what all those folks are thinking out there about all that, but I think the whole role of regulation can be misunderstood really easily, and it's nice to hear what we're hearing here. I think, I don't think you responded to that question, because I've been checking off names here. So what would you like people to know about what you do?
Again, like I said earlier, I think the biggest thing in regards to the Child Care Assistance Program, we are partners. That is our goal. We want to partner with DESE, DHSS, Head Start, Early Head Starts, and folks at the local level to make sure that, one, children are safe first, and two, that we support the early childhood infrastructure and moving it forward so that kids are ready to succeed. That's what we do. We do recognize that, the families that we work with and partner with are receiving Head Start services during core hours, and we do recognize that the Child Care Assistance Program may be used during those non-core hours for those facilities who participate in the Child Care Assistance Program. And our goal has always been to be available to answer questions and make sure that our policy is clear from the Child Care Assistance standpoint so that folks are compliant both on the subsidy side and on the Head Start side.
It's your turn, Mike.
Okay.
Don't want to leave you out.
Well, I think a lot of daycares we're only in there once a year for a sanitation inspection, and it can be, he's just here to write me up for something, but it is a partnership. And during the rest of the year, you're self-regulating yourself with with oversight by the regulatory agency, but what you do or don't do in that daycare can have a huge difference in the health of your children. You all read the newspaper and you see when a cruise ship goes out and it's out in the middle of the ocean, everybody's sick. Well, you have a cruise ship, and norovirus is very common in daycare. And just a coworker that's being careless on hand washing can really cause a problem. In the Eastern District, we had well over 1,000 Shigella cases, and that is easily stopped with hand washing and just some basic sanitation, but it wasn't being done. So what you do the rest of the year when we're not there makes a huge difference. When your baby that you're taking care of weighs 15 pounds and they get diarrhea really bad, they can be in the hospital real fast from dehydration. So think about what you're doing. Just those little things like washing your hands can make all the difference in the world. So we're not there to punish you. We're there to help you succeed and keep these kids healthy. Because you're going to bring it home to your kids too, your own family. So just think about what you're doing in the daycare. And if you have questions, that's what we're there for. If you have a disease outbreak, we'll bring information. We'll help you with the exclusions. We'll help you with the parents. You can always blame us to the parents. But we're there to help. We're not there to hurt. So if you need any help or if you need somebody to talk to, we'll be glad to talk at any time. Or we may come out for a special to see if there is a disease outbreak, to show you some things you could do to help stop it, to minimize the occurrences. But we just hope you'll think about sanitation the whole year, not just when we're there.
Oh, that is so important. I think, looking back at Head Start regulations, and it's always been a regulation, for example, that people wash their hands after changing a diaper. And then when you see that someone's gotten a finding around that, when the monitors are there, you think, what does it look like when they're not there? And so what you know is they don't really have an understanding of why that's so important. It's just a rule, and they don't really get it. Thank you. I want you to think, it comes back to some of the stuff you've said, but think a little more about this and think about and give an example from your own work, which in a sense you've done, but you probably have another example hiding there in your head of the positive role of regulation. Sometimes in Head Start, I don't know if we're bragging or complaining, but even before reauthorization clearance, we had 1,800 specific separate regulations. And it's kind of like, what? And so we complain and brag at the same time, and now reauthorization has come in, so that number has grown. But even though we may fuss a little, we know that regulation helps us, even when we're annoyed maybe by it. So I'd like each of you to think about an example from your area where regulation is positive, that we have a real need for it, and when it's not there, bad things happen to children and families and all that. So who'd like to start with that?
I can start.
Okay, Mary?
Well, I think what we've been hearing is health and safety, and I think that's a big piece in monitoring for Head Start. Health and safety, that all children have access to health and dental care, that all children have screenings and referrals, that there's safe physical environments, again, hand washing, that children are monitored, that children are supervised at all times, healthy practices and routines, appropriate group sizes, we know that's important, and then the transportation and supervision. We know that when little children are on the bus, we know that it's so important that those children get off the bus and into the hands of the center or the providers, and that we don't have any children left on buses, that they're not unsupervised. So health and safety, I think that's what we're hearing today a lot of, but that's a huge piece of the monitoring in Head Start.
Well, it is. Certainly health and safety is huge. It's not the only thing out there. There's a whole lot of things,
Right.
A lot of regulation. I mean, we do want appropriate ratios, not only for the health and safety, but for the mental health of children, that they have a caring adult to be with, and that person has some training and understanding of child development.
I think when you reference the 1,800 some regulations, you know, when you look at just health and safety just being one small piece, but yet it's a huge piece of everyday routines too. So
It really is. It really is. Who else would like to respond to that question? The positive role of regulation and how it protects children and families. Looks like you're ready.
I was going to share that regulation is something that is, because it is geared at prevention, it's very difficult to prove that it protects, because how do you prove that having this in place actually prevented something? Because how can you count something that didn't occur? Hopefully because you've prevented it or put safeguards in place. From the section for child care regulation, we're asked at least annually, you know, about our work and what we do, and numbers drive so many things, and for regulation that is very difficult to say, here's definitively what we've prevented. But as Kathy pointed out, in 2011, we did change our regulations regarding infant and child CPR and first aid. And we have seen we have received actual stories about children who were saved because someone on site knew how to do infant and child CPR. And so that's certainly, obviously, a positive impact of regulation.
Absolutely, and the statistics are clear, even though maybe we can't say this child is alive because, but we can look statistically like back to sleep, that when infants are placed on the back, that the death rate for SIDS drops dramatically. So we certainly know that. Okay. You want to talk to us? Why not? Be brave.
The fire safety standards are based on, and Sue alluded to the fact that, you know, it's difficult to prove that something's working when you don't have statistics to back it up. And how do you know how many fires would have been created or allowed if we didn't take proper steps to prevent them? And prevention is what we're all about. If we can stop a fire from occurring, then we stop injury, we stop property damage, we stop relocation, we stop all the expenses that are then involved. And that's what we're trying to do. So we've added different components to the fire safety things that we look at, and one of them is carbon monoxide. How many of you have ever smelled carbon monoxide? Good, because you can't smell it. How many of you ever smelled smoke? Oh, come on, yeah, everybody, right, okay. So smoke detectors detect smoke, right? Carbon monoxide detectors detect carbon monoxide. Carbon monoxide is that very insidious killer that takes care of young people and old people in the first round and everybody else in the second round. And if we don't have carbon monoxide detectors that are installed and working properly, and just to give you an example, you wanted an example. How many of you had yesterday off? State workers and such. Okay, I was off too, but at 8 o'clock yesterday morning, I got a call from a local fire marshal in an out part of the state that said, "Ron, we just evacuated one of your daycare centers." Why? Because of CO. Detectors went off. We came in with our readings, our detectors, and they were very high. The facility was licensed for 100 children. Now, what would have happened had there not been a carbon monoxide detector in that facility? These are the kinds of questions that I don't like to answer when we're out there getting that question from the press or from the governor's office to say, we thought you were inspecting properly. And you know, why are these things out there? Why do we have these safeguards built into our systems? They're built into the systems because bad things have happened in the past. It's difficult to calculate how many lives have been saved or how many injuries have been prevented, because of these safeguards that are now built into our system because they didn't occur. And that's what we're out there all about, is trying to make sure that the facility proprietors and operators are doing what they're supposed to be doing in accordance with the rules that have been put in place because people have been injured or killed in the past. And that's just one instance that I can give you a whole laundry list of others, but.
I think it's a really good point, though. Most of those rules came because something didn't happen, and somebody said, we got to have a regulation around that. It may have been a long time ago, and you don't remember it or I don't remember it, but it still happened at some point. There's some reason. Somebody didn't just wake up one morning and say, we should really do this, just so that everybody will be annoyed. There was a reason. Always a reason. Okay. Are you ready to talk to us a little bit, Craig, around this question of the positive role of regulation? How would you explain that to somebody who says, you mean we can't do X?
Well, I think a lot of times, whenever your environmental inspector is in your facility and they may be writing you up for a chipping paint or a mechanical vent fan not working, or just it seems like little things, but it comes down to maintenance. I mean, you got to maintain your facility. I mean, I know kids are hard on stuff. They bang up the baseboards, the walls, whatever. Mechanical vent fans go out, but those all things are put in place, like Ron said, to prevent things, odors from happening in the bathrooms. Chipping paint, we don't want children eating chipping paint or that's falling off the baseboards. So just maintaining your premise and making it a safe environment for the children.
Thinking of that and moving on to you, Mike, talk a little bit about lead and your role of your department in ensuring that children don't chew lead paint off the crib or the windowsill or whatever.
Well, in the urban areas especially, lead paint hasn't been produced since 1978, but of course those structures were all built, some in the 1800s even, in St. Louis, for instance, or Kansas City. Lead is a pervasive problem, and we're always going to have it for the foreseeable future. In fact, the federal government has recently cut back on funding for lead abatement, so we'll probably be dealing with it even more. But we're all, at least in the Bureau of Environmental Health Services, are lead certified, lead abatement assessors, lead risk assessors. And we take out an XRF machine, an X-ray fluorescence machine, and we can get a very accurate reading that HUD recognizes and find out what the lead content of that paint is. If it's chipping and peeling, then we have a very strict abatement policy for that, and so they have to conform. And at the end, we'll do even lead dust wipes to make sure it's been cleaned up properly. But lead is so pervasive. There's a lot of research on lead causing learning difficulties in children, anemia. Lead paint is actually sweet if you were to eat it. Lead has a sweetness to it, and this is why it's attractive to children. But more than just the lead paint chips, we're concerned about lead dust. Opening and closing windows, opening and closing doors. The kids pick that up, breathe it, and it gets in their lungs, and it goes directly into their blood system. So, and that accumulates over time in their brain tissue or nervous system. So, by the time a child is 15, they may have been exposed to a great deal of lead over their lifetime, and that may account for some learning difficulties that we've seen. And not only lead, we're beginning to, because of the increased asthma and allergies, we're beginning to try to limit exposure to chemicals in daycare centers as early as possible. If I could just get daycare centers to read the instructions on the chemical cans, it'd be nice. Because most of them say not to use them around children, but they're always there, and they're being used, and just read them. Or it says not to use it around food. But children's skin is a lot more absorbent and transparent than ours are, thinner. And they pick up chemicals very easily. So even in pest control now, we're using integrated pest management. We're all going to be going through pest management school. we want to make chemical treatment the last resort, not the first. So instead, we'll start doing more like filling in holes and weather stripping and screens, all those kind of things, cleaning, to try to keep chemicals away from the kids as much as possible.
I want to come back to you in a minute. I want to get to Alicia, but I want to hear a little more about that. I think we all probably want to hear more about, how you share that information. But Alicia, we still haven't heard from you in terms of what's the positive role of regulation where you live and work?
Well, I think for us with the Child Care Assistance Program, 79 to 80% of our children are in licensed care. So we know if they're in a Head Start, early Head Start facility, they're in licensed care. One of the things that we require for those folks to be, they have to have a valid license with Health and Senior Services, and they have to be compliant. That gives us some assurance that, at minimum, we know the basic regulations are being met. Not saying everything is perfect, but we have some confidence in what's going on. We know that somebody is out there on the ground and is able to go in and out of those facilities when necessary. Our partnership with licensing has continued to grow over the years, and we continue to look at things not only just in the area of regulation and sanitation, but also in professional development and trying to figure out what we need to do as a collective group in moving Missouri's early childhood system forward.
Yeah, I think, it gives credibility. Any of us, probably every single person in this room wants a person taking care of their child that has some qualification and some preparation. But individually, we might have trouble making that point. But when it becomes a regulation, then we have something, a foundation to say, do this or do that, because it's really important. And I'm not the only one that thinks so. So I think that's hugely important. Thank you. When you were speaking, Mike, I think that you were starting to answer this next question, but I want everyone to think about it, because having some responsibility, certainly for compliance, which everyone around this table does, but we know what's more important is understanding and strategies for people that are trying to make it happen. I mean, I think I'm really compliant with speed laws. When I see a highway patrolman, I'm not quite as compliant if there wasn't one real obviously there, but I think compliance is one thing, but understanding and doing what's right is even more important. So I'd like to go back, because you were kind of starting down that road. Some of the strategies and assistance that you have available for anybody, whether it's Head Start, child care, whoever it is, to actually understand the regulation and perhaps even to find training or more information on it and to be compliant.
Well, to start with, we have quite a bit of information on the website, Missouri.gov. If you go to the Department of Health, we have a training manual we call EHOG, which is Environmental Health, Operational Guidelines. And anyone can look at that anytime you want to. All the environmental health programs are in there, but if you just type in EHOG in the search engine, you can go to child care, or you can go to food preparation, or on-site sewage if you want to, but you can find out basically what the state regs are. Now, we are doing reorganization in the Bureau anyway, and there is a great deal of training going on, more than I've ever seen. And hopefully that will filter down to the local environmental health officials over the next year or so. There should be a lot more information out soon. I'll be preparing a new training manual, and we're all attending new classes, and all the environmental health folks are going to be doing childcare. So they're all going through training right now again. So hopefully as we train the locals, this will get better. And we encourage you to call anytime for any question you may have. It doesn't matter how minor it is. That's what we're there for. We'd rather catch it early than later. Again, it's nice in a daycare if somebody in charge is in charge and not having each individual child care person doing it the way they want to do it. even mixing spray bottles. I've got 10 different people doing spray bottles, and they're all different, every single one. I'll look at one and it's so yellow it's straight bleach, and the next one will have nothing in it at all. I mean, it would be good to have that, somebody at the child care maybe has a specific job that they really know well. Or maybe we can show them how to do pest control or something like that. But to have everyone be an expert in everything is impossible, of course. But I think we're there for education, I hope, as much or more as enforcement.
So if someone wanted more information about what that solution should be, they can go to your website and get it, or they can ask
Either
their
one,
person that
or
comes out?
Or I'll come out.
Yep.
One of us will come out. We're glad to, anytime.
Okay,
It's not a problem.
great. Who else wants to talk about this? Supporting understanding as opposed to just do it. And how do you support understanding of the rules and regulation and provide support for actually becoming compliant? Who wants to talk about that? Okay, here's a brave soul. Let's hear you from you, Sue.
I think this is some of what Ron touched on earlier. Our staff, including Ron's fire safety staff, I think, as a gauge from what he said earlier, provide a lot of education on the rules, one-on-one, hopefully at the time that our staff are in the facility doing the inspection. And if you or your staff have questions, you should feel free to ask the child care facility specialist, the sanitarian, the fire inspector, whoever's conducting that inspection. If you have any question or don't understand, or just need to know, why is this important that I do this? Where can I find it in the rule book? And our staff should be able to answer those questions. If for some reason it is not a satisfactory response, or you don't feel, obviously resolving issues at the lowest level, like Ron said, is everyone's goal. But if that doesn't occur, for child care regulation, there are supervisors. Everyone has a supervisor. And you guys got information in your packets about, who supervises whom within our structure. And the supervisors would be happy to answer questions as well, provide training. If you have training needs, feel free to talk to our staff, our supervisors, to get what you need to be in compliance with the licensing rules. Because again, that is all of our goal, is for your facilities to be in compliance and operating smoothly.
So is there, if a child care director or a Head Start health coordinator, somebody wanted specific information to share with staff, they could get it from your organization?
Yes.
Okay, and how would they go to the website? Would they call their,
We have information on the website, but I guess if the question is about a specific regulation, or the child care facility specialist would be the best person. And then if for some reason the communication isn't good, or you still don't understand, then seek that information from the child care supervisor.
I guess, I can see, I was thinking, maybe I wasn't really clear too, like, are there training materials out there that someone other than yourselves can use, or would they need to contact you for a training? Are there materials they could use with their staff?
Our staff have access to a lot of resources. So if there are questions about a specific topic, biting, or, our staff could provide resources to you.
Okay.
In terms of training, our staff, there is a training on licensing rules that our staff provide. We could also give you ideas about where to get other training on a specific topic.
Great, okay. You look like you're just really eager to talk, and we want to listen, so go for it.
Well, I'd just piggyback on what Sue said. The Division of Fire Safety's website, in the inspection unit section thereof, you can go to information, which our website to get to us is inspections@dfs.dps.mo.gov. That's on our website. That goes to our office. My office assistant would get that. If you have specific questions, or you need assistance in providing training to your staff, or you want information about where you can gain that kind of information, we can provide that to you simply by contacting us. And there again, call us on the phone, email us, whatever. We'll do what we can to get that to you. Again, the first step is if you've got somebody in your facility, ask them. If they can't provide it, then ask them for our contact information, and we'll send it back down the line and be happy to talk with you.
Who wants to be next? I know this is so much fun. Mary, you want to be next?
That's a pretty big question that you asked, Rhodanne.
I know, it really is, yeah.
I don't think there's one answer, but I try to hit a little bit on, I think we look at successful partnerships built on the strengths of all programs to better serve children and families. And I think what we've heard today from all of us is to draw upon the strengths of everyone here today. Not one program can do all, be all, train all, but building upon what's existing in the communities and using those resources to be compliant. You know, for Head Start programs and early Head Start programs, there's so much information out there constantly. Clarence referenced the national training centers, and as you all know, there's so much information now coming from those training centers, it's hard to keep up. So who do you have in your program that can alert you as a manager or director to say, hey, this just came out, or were you aware of this, or, you know, how can we inform everyone, not just at the top, but all the way, you know, all the teachers, the home visitors, et cetera. So being in compliance with everything, it sometimes is a daunting, you know, job to be able to keep up with everything that's out there. But, you know, our eClick website does, you know, fairly good job, I think, of keeping people informed. It's just taking the time to be able to get all that information. And of course, again, as we always hear the information that comes out of the Office of Head Start, if you have questions, call your regional office. So
The infamous line,
Yes.
even TA does that.
right. And, well, and to piggyback
Call
on
your
what you just
regional
said,
officials.
you know, we do have a great TA system, and thanks to you know, you folks that are out there and all the time with our programs and helping them, I think that it's just tapping into all those resources. So.
Yeah, I do think it's, you know, we just live in an information age, and sometimes there's a lot of stuff coming at people, but the ECLKC is for anyone, and you can just put ECLKC in your search engine, and you will get there. And you mentioned National Centers, as did Clarence, and there's wonderful information there, especially around anything educational, and certainly some health and other things, but I mean, there's really a lot of information and training materials. So no one has to reinvent something or make something new, which that's why I was kind of asking these questions. I think my experience with Head Start or child care is people are really busy. Am I right about that? And they really don't need another thing to do, but if they can access something that's available and easy to use, I think that's really a step ahead for everyone. Alicia, talk to us a little bit again about this compliance issue. We want people to be compliant, but we know that it can be a struggle. How do you help programs that are trying to do well but just struggling with it for one reason or another?
Well, I mean, obviously, one of the things that we do at social services, we do provide quality support services, but I think the biggest thing that we do is really a sharing of information, making sure that people are educated about what our expectations are, what our partners are doing, and what we're doing, and that we're in it together in order to move childcare forward. A lot of times we think people know and they don't know. And making sure that we're asking the right questions and that we have the relationships with the folks at all levels, whether it be directly with providers, parents, our state agency stakeholders, and our other community partnerships, because we really get what we get done by working together, and we can't do it by ourselves, so.
Absolutely, and all of you folks at this table have a piece of it, but that collaboration is really what we're trying to get at. Mike, what are you thinking about this compliance issue and how to help people become compliant?
Well, sometimes it takes more than, just putting a violation down on a piece of paper. Sometimes there are ways that you can come into compliance that you might not even have thought of. Say you're adding an infant toddler room, but there's no way to do plumbing in that room because everything's concrete. So you might have to jackhammer the concrete floor up. Well, you're talking thousands of dollars there. We might be able to work out a variance and install say a portable hand sink that has, a pump in it and a heater, and might be able to work something out that way. Just because it's down and you can't think you know the answer, if you talk to your sanitarian or a supervisor for that program, you might be able to come up with a different option that would be just as effective of getting you into compliance, but you hadn't thought of it. And there's other things like that. If it's a non-critical violation, we might be able to extend the time on it, maybe give until the next licensing year. It just depends on what it is. If it's a critical, we're probably not going to bend like that. But if it's a non-critical, we might be able to bend a little on that, especially if it was missed by the local for years and all of a sudden it's popped up. There may be ways to spread that time for compliance a little longer.
That sounds like a great idea. Any other comments? Did we get your comments on this? You never escape.
Not on that, but I saw some eyebrows raised on whenever a local inspector might have missed something, and next thing you know, a state inspector's coming in, and whether it's a change of ownership or a change of capacity or something, and we have to come in anytime the licensing specialist gives a request to go out, then the state comes in and we'll do our inspection. Unfortunately, sometimes things are going to be expensive, whether it's installing mechanical ventilation. If you're under a certain date, there was a grandfathering, for mechanical ventilation. So, if you change capacity or if you deviate away from your licensing, then you're going to have to meet those new standards. So, so then you'd say if it was mechanical ventilation, you'd be required to install that. So if there's a hardship there, then there's some things we can maybe look at if, you got a concrete ceiling and you can't install them. So there's certain things we definitely look at. But the point I guess I'm trying to make is if you deviate away from that license, you'd have to be compliant with the standard rule.
Well, and as I heard you talk, it's probably also important, but we've all been here at some point in time, and that is to, before you buy it, agree to move into it or sign a lease. It would be wise to look very carefully at what you're doing. It's a lot harder once you're involved in it. According to my timepiece, we have 5 minutes left, so 2 things need to be happening. You need to be writing questions that will come back to these folks. If they haven't answered your question or you have a specific thing, this would be a good time to start writing it. I'm not going to tell you what to say. I would like each one of you to do kind of a closing statement in our 5 minutes. I guess what I would love to hear, I think the reason I'm standing behind this podium today, I'd have to say that I got drug into early childhood kicking and screaming when our 3rd son was born, and his special needs forced me to move into a field which I now love and call my own. But I'm just wondering, what is it that motivates you in your work?
Well, for me, I think children are, of course, our most precious resource. And I love kids, and I loved my own kids, and I certainly care about your kids. That's what we're here for. They're the most vulnerable in our society and deserve the most protection.
Absolutely.
Well, as a grandparent, a 4-year-old and an almost 2-year-old, I think about them every day because one's in a preschool and one's in a family child care home. And but I think about all those families out there that don't have the opportunities that maybe my grandchildren have, that don't have the quality care. They don't have a voice, or they don't know how to advocate for themselves. And that's really what we should be doing for all of our children. We need to be there. We need to make sure that all children have equal opportunity and they have quality services. And the dollars that we put out there, we have to, goes back to compliance, making sure that our facilities are compliant with the dollars they use. So I guess I could go on, but that's kind of what motivates me.
Wow, that's a big question. What motivates me, having worked in juvenile delinquency, having worked in child welfare, kind of backed into child care, my belief is that if we can get it right early on, we don't have to worry about dealing with kids and families having to deal with the correctional system. This is a worthwhile investment. Head Start is known for working with whole families. We appreciate that. We understand the extra support those families get who are engaged with you all. And I don't normally say this, but as a Head Start alumni, I think you did a good job.
Woo! I think so too. Thank you, Alicia. Final words?
Something I always think about whenever I'm, I guess, in a facility is I tell the providers that, these children, they cannot protect themselves. So that's our job, and that's your job. So we got to make sure that we remind them of that, and that they protect those children every day.
The question, why it is I do what I do. I've been in the fire service for a very long time, longer than some of you have been alive, I'm sure. But the purpose in mind in the fire service is to save people's lives. And when you can't do that, you save other people's lives. And in the child care realm, like was said here, they can't take care of themselves. We're the adults. We're the ones that have been charged with their care. And when we don't do our job, we put them in danger. It's just that simple. So we do our job to keep them safe, so you can do your job to keep them safe.
I think regulation is a challenge. It's a challenge because you either have done not enough or you have done too much. There are always people that will say you are, doing way too much, and then if something happens, why weren't you there? Why didn't you protect, in this case, children, very vulnerable population? For me, it's exciting to come to work every day where I feel I can make a difference. Prevention, licensing is all about prevention, and I'm passionate about children as a mother and grandmother and love children, so it's a perfect combination. It's exciting. There are so many interesting stories that happen that you can't even imagine. So it's never boring. It's always something different. And I think just the challenge of trying to strike an acceptable balance between the needs of the population and the people that are serving that population.
Absolutely. We are going to have questions from the audience, but before we do that, did you not feel the passion from these people? I certainly did. Can we give them a big hand? Say that again. Okay. Okay. Sue and Ron. All right. In the wake of a recent school shooting, we had law enforcement officials review each of our facilities and make safety recommendations. They universally advise us to install locks on all classrooms and bathrooms. Our licensing rep and the fire marshal have forbidden these in the past. Will this be reviewed or revisited? Sue and Ron, your name is on this card. Glad my name isn't on that card.
Actually, Ron and I have had a conversation in the last month about this because we have heard that more and more programs are having law enforcement personnel come into their programs, and obviously, safety is key, and we are sensitive to the issues of wanting to protect the children, wanting to protect the staff. I think it is a very it can be very individualized toward each program because every program is arranged differently physically and all of that. But our discussion has been that we will address these as they come up. And do you want to address what you've talked with your staff about?
Sure. The issue of locking doors that are meant to be exits in a time of fire, and how do you unlock a door that's been locked securely if there is a fire? How do people get out? It's a question that's being asked not only in Missouri but in other states around the country, and we're having forums, if you will, at the local level with school districts and law enforcement providers and fire safety people and child care people and all of the different facets of the community. The question, is there any alterations in the regulations in the near future? I'm not sure. From a fire safety standpoint, the National Fire Protection Association and the International Codes Council set the tone for those kinds of regulations. At the state level, from child care regulation, I haven't heard anything in the wind of changes for those things. Sue alluded to the fact that maybe it's a local issue, maybe it's something that could be dealt with on a case-by-case basis. That's really not very consistent, but that may be the way it has to be addressed in the short term. In the long term, I think we're going to find that there are large and long and in-depth discussions involving a lot of people and a lot of organizations to come to a conclusion on how this is going to be addressed effectively to meet the needs of both security and fire safety, because those are the two main concerns that we're dealing with when we start talking about people that cannot take care of themselves. And that's where we are, I think. So right now, I'm not going to get into specifics that I've actually had discussions with other people about because it's such a broad topic that it's going to take some time of discussion, and people at a higher level pay grade than me are going to make those decisions.
But it does sound like it's in the conversation stage, and that's where it starts. People have to think about it and talk about it for it to get resolved, so those are good questions.
There's a lot of discussion out there right now.
Yeah, okay. This is for Sue and Mary, so I don't know if you want to stand up here together or just listen to each other. Here's the question. It's a tough one. Currently, 3-year-olds in early Head Start family child care homes can remain in care until Head Start opens. In other words, they can stay there for overtime. Center-based early Head Start 3-year-olds must be dropped from care on their 3rd birthday. That's a licensing rule. And Head Start cannot consider a dropped 3-year-old an enrollment priority. That's from the Office of Head Start. You can see how they're showing all these different regulations coming together and trying to figure out what to do. How can we work together to continue services to children birth to 5? In other words, what's the path really to resolving this? And either one or both of you, would you feel more comfortable up here? Or you want to stay where you are?
I don't care. Sue, what do you think? Do you want to tackle that, or do you want me to piggyback?
I can
Okay,
start and then you can.
that'd be great.
Well, from a licensing standpoint, there isn't a requirement that 3-year-olds be dropped. Obviously, there are 3-year-olds in care, so I'm assuming that the question is that 3-year-olds need to be moved from an infant-toddler unit into the preschool unit at age 3. And to me, it's an issue of planning, because knowing that these children are going to turn 3, doing some planning ahead in terms of transitioning them to the preschool unit from the infant-toddler unit.
Okay. Mary, do you want to talk
Well,
about that?
yeah, and I appreciate what Sue said, because I do agree with you, planning is the key. One thing that we have to consider is sometimes our parents, we have to help them through that planning phase. And we know in early Head Start that children, when they turn 3, that they can be in a setting with a mixed age group, that the services are individualized, and that every child has an individualized plan. So I think this is something that we can't solve today. I think it's something that we should continue to discuss amongst ourselves and think about what we can do to help parents through this planning and transition phase. We know that in Head Start we have to have at least 6 months prior to the child exiting the program or turning 3, that we have to have a transition plan. So we know that we want to help that child be successful in the next program that they're in. And I don't think there is an answer. I can't give an answer other than I think we just need to continue to talk about it and how we can continue to serve those kids. Because, you know, it does seem to be a problem because we can serve children if the child turns 3 in May and maybe he's Head Start eligible, that child's not going to be in a program until, say, September. So what happens in between? We don't want a kid to be dropped. You know, certainly we want to continue the best quality services available. Parents who, you know, financially strapped, how can we help them? So I think we've all heard today about what it needs, what we as partners should be doing. It's a matter of what can we be doing, and sometimes it takes a lot of planning and strategies to do that. So.
Yeah, I totally agree with you that the planning issue is huge, and there are some extenuating circumstances sometimes out there for our programs, but if they don't have full day, full year Head Start, then there's, you know, that 3-year-old is probably going to have to wait until fall. So that's just one of the.
And I think too, I know that Kathy talked about illegal care, and sometimes we do see those families who, unfortunately, there's not another program for that child to go into, and we can try to help them plan as much as possible, and that child gets sometimes left at, you know, a place that we wouldn't call quality care, and we know that that's out there. We just need to continue to dialogue about this issue and talk about, you know, what can we do?
Absolutely, and part of it certainly is parent education, because parents will always have to make hard decisions about their children, and we have to help them learn about that. This is going to be fun, you two, because we talked about this at lunch, and I didn't know there would be a question, but here it comes. This would be for Ron and Mike. No, not Ron and Mike. It would be for Craig and Mike. The balance between necessary and helpful sanitation and important child development experiences, such as digging in the dirt, sandboxes, natural sanitizing, there's one of these words I can't, properties of sunlight, okay, exploring natural materials, antlers, turtle shells, we talked about that, and cured pelts and skins. So you guys go for it. I actually heard the answer to this question, so here we go. Who wants to go first?
Thanks a lot. Well, I mean, there's a difference between finding a dead animal in the woods and having the kids play with it and having somebody bring in a dried skin. That's a whole different thing here. But there are a lot of things that you can do educational-wise with the kids outside. We don't discourage them from playing in the dirt or the sandbox, even a garden. But we do encourage you to come wash your hands as soon as they're done, same as a water play table. Now, I'm not saying you don't have a local that might say something that probably shouldn't, but if that's the case, let me know, we'll talk to them. But there are things that you can do. Even animals, we don't want you to have certain animals at the daycare, like reptiles, but that doesn't mean you can't have somebody come from the zoo and bring a reptile and show it as part of an educational training that day. And then the kids will, again, if they touch the animal, go wash their hands before they go back in. But there's still ways to have educational programs and not interfere too much with good public health. but you may occasionally run up against a local sanitarian that may have other ideas. If that's the case, please let us know and we'll continue with training.
Do you want to add anything to that? Your name was on the question.
Mike covered it just.
Okay, here's one for Alicia. Alicia mentioned those receiving child care assistance are receiving licensed care. Did I misunderstand? Aren't registered vendors those who care for 4 or less not licensed and receiving child care assistance or subsidy money?
Can I answer that? What I said was that the majority of the children who receive child care assistance are in licensed care. Yes, we do register 4 or less family home providers who are serving 4 non-related children. Parents have a right to choose if that's the provider that they choose to select. Of course, if that provider can meet our requirements, then obviously they can register with us.
Okay. Are you watching the time for me? Okay, here's another really good question. If we've raised a question that goes on to a supervisor, that'd be almost everybody here at this table, does the clock keep ticking? If an inspector says he will consult a supervisor and it takes several weeks for a response, have we cut short the time we have available to make the change? Somebody understand that question and want to respond? You look like you had an answer. You looked willing to talk.
It better not take several weeks in my shop.
Okay.
I mean, if we can't get an answer back in like 2 days, then, and yes, the clock does keep ticking if there's been a signed inspection.
But it should not take
It
weeks.
should not take, no. If there's a request for a variance or a time waiver or something like that, it may take as much as a week. But beyond that, no. Any common question that's raised about what we're telling you to do, we should be able to get you an answer, and I'll use the term short order.
All right. And if we get in trouble, we'll have you define short order. Sue, does that apply to your work too? Could it?
When Section for Child Care Regulation staff conduct an inspection, and I'll just go from an inspection standpoint, they're not putting, we used to put compliance dates or correction dates that we expected to see. We don't do that any longer. So when staff are coming out, they're not saying this has to be corrected within 2 weeks or 1 week or whatever. So so the facility would remain out of compliance, I suppose, until an answer is given back, so.
Okay. Okay. Oh. Does that apply to anybody else here? I guess it doesn't too. Okay. And we're out of time. Folks, again, thank you. Did you have fun?
Sure.
Did you have fun? Did you have fun? All right. Thank you so much.
Thank you to our panel members, and thank you, Rhodanne, for facilitating our discussion. Now that we have fed you a fully loaded carbohydrate lunch, I think it's time we do a little moving around, perhaps. My name is Tina Bernstetter. I'm the Executive Director of the Missouri Head Start Association. And before we break into those small groups, I just have to tell you, thank you so much for being here today. This is a really large discussion, and we know when we began the planning, we knew we weren't going to get all the answers today, but we knew we'd have a lot of questions and hopefully some next steps of where we need to go next.